Hi, I'm John Chowell,
And I'm Julie Aubert.
and we are with Periorthopedic and Plastic Surgery in the Physical Therapy Department. We are here to talk to you today about pre-rehabilitation for rotator cuff pathology.
Just as a quick disclaimer, at Prairie Orthopedic, we follow all the CDC recommendations and guidelines. We wear masks 100% of our day while we were working with patients and even at our desks. But for the purposes of this video, we are going without masks.
So one of the big things that we get asked from our patients is essentially, what is a rotator cuff? What is rotator cuff pathology? And what is a quote-unquote rotator cuff tear that leads to so many surgeries? So we're going to talk a little bit about that.
Okay, so the rotator cuff, there are four muscles that work your shoulder that are considered the rotator cuff. And those four muscles can get injured from numerous reasons: overuse, a fall, lifting something heavy and it being too heavy for you. So there's many ways you can injure your shoulder, not necessarily just an acute injury. It can be over time. So as we get older or we do something repetitive, you can end up with a tendonitis that turns into a rotator cuff tear. So having said that, why would you want therapy for something that may or may not be a tear?
So one of the complexities of a rotator cuff tear is that it frequently happens over a long period of time. And so, yes, it can happen traumatically with single incidences, but for the most times, individuals they develop, maybe you've heard your physician talk about a bone spur. You talked about different pathologies and scar tissue development in the joint that kind of leads to these kind of long duration kind of issues, and it just kind of comes on over time. Well, the issue with that is when you have, whether you have rotator cuff impingement, which is one of the things that can lead to rotator cuff tear pathology, or if you have a kind of another issue going on, whether it be a neurological event or if you have some sort of injury leading up to it, such as like a broken arm, is that it really does cause the system of your shoulder to kind of dwindle down from maybe what you remember it being when you're in high school or college or as a young person. And it really starts to weaken the muscles around the shoulder, and it can decrease your posture. It can really mess with a lot of your activities of daily living. But for the most part, we tend to just kind of saunter on. So a lot of times in our profession, we frequently have to talk to patients about things that they can do to help strengthen the muscles that aren't directly involved, but they are very much involved with the rehabilitation process. So
yes,
a lot
and decrease their pain prior to surgery. You might not need surgery if we can handle the pain, if we can manage the pain and actually eliminate the pain just by changing a couple of things. So we can work on your posture, we can work on your sleeping positions, show you the positions that's going to be most beneficial to allow those tendons to have decreased irritation from the bone spur or the swelling. We're going to get you in positions that are much more comfortable, and you may end up being able to manage it without having to have an MRI that costs however much money that your insurance doesn't pay for. We want to intervene prior to having you have surgery for a needless reason. Not all rotator cuff tears or pathologies need surgery.
In fact, we actually see that a lot of people from various researches, studies with MRIs actually show that a lot of people who don't have pain, who don't have symptoms, actually do have a rotator cuff tear to an extent. But they don't know, it's not painful, it doesn't impair their functionality. Maybe it's a little bit weaker, maybe they have some loss of range of motion, but for the most part, they're pretty happy and healthy. So,
John, when would you want to have surgery for a rotator cuff tear?
well, ideally never. But but
what would be the reasons?
Yeah, at the same time, there definitely comes a time where the shoulder does become a detriment to lifestyle. You're looking I can't get dressed in the morning. I'm having difficulty putting things up into high places. I'm unable to lift my child or grandchild. And so as we get older and as we continue to have injuries and things like that, those things can really start to weigh on us, and we start to kind of miss out on some of the small things in life, but also kind of the big things in life. So, especially if your pain is unending, it has failed with conservative treatment, whether it be prior physical therapy or other conservative care, medications, and so on, that might be the time to really have a discussion with your physician and surgeon about potential for a rotator cuff repair. And at that point, then they would start to kind of take you down the line. So, anything you want to add?
I would add if you're not sleeping at night, if it affects your ability to sleep at night, even with the positional changes that your physical therapist would recommend, especially here, we recommend specific ways to go about getting comfortable at night. And if you cannot get through the night because you're in such discomfort, that's another indication that surgical intervention may be appropriate at that time.
If a person is already dealing with some sort of shoulder pain right now, what are some things that they can do very simply at home that could help to relieve their stress on their shoulder at night?
Okay, so at nighttime, why don't we get you into a position that I would recommend for somebody to try to sleep at night in. So I'd have you lie on your back, and then I'm going to take one of these pillows away. And so I would recommend like one pillow under your head. If you can't sit with, or if you can't lie down with one pillow, two would be the max that I would recommend. If it's your right shoulder, I would recommend putting another pillow under your arm so that your upper arm is supported up above the height of the bed, and then the pillow comes up over your waist, and your hand is resting right around your waist on that pillow. This alleviates the strain on your rotator cuff at nighttime, which will allow you to be more comfortable. Now, if you have any low back injuries, I always recommend to put a pillow or two under your knees so that you relieve the tension or the strain on your low back at nighttime. So this would be an ideal sleeping position. You also could put another pillow under your left arm. You're going to be loaded with pillows at night, but this is just how it works. It's going to get you through the night. The biggest thing I always tell people, if they're not back sleepers by trade, if this isn't your go-to position, then I would recommend that every night when you go to bed, you get yourself into this position for the first 15 minutes. If you don't go to sleep at that point in time, go ahead, roll over, don't ruin your night's sleep. But always, always start to train your body to get into this position at nighttime. Eventually, it will become more comfortable for you and you'll be able to fall asleep in this position.
If it is my right shoulder, is it okay for me to lay on my right shoulder?
Absolutely not. Under no circumstance would we want to have you lie on the shoulder that is the one that's hurting. At the very minimum, you can roll over onto your side with another pillow under your arm here so that your arm, your injured arm, doesn't fall forward onto the bed that way. So we're going to want you back on your side. You're going to end up with some sore shoulder on the opposite side eventually if you continue to sleep in this position. So I always tell people, at the minimum, sleep on your opposite side until you can get more comfortable sleeping on your back. Anything to add there, John?
No.
No.
Can you turn the lights on?
What else?
Well, the only thing that we could really say, along with some conservative treatments, your physician may recommend a regimen of anti-inflammatories, Aleve, ibuprofen, various other medications can be provided. Some patients may be provided with Mobic or meloxicam, which is a stronger anti-inflammatory, which can be beneficial. Calming down this inflammatory process sometimes can lead you to the separation of, I have a shoulder injury that is very difficult to live with versus a shoulder injury that really does need a surgical intervention.
Would you ice a shoulder like that?
Absolutely. I would recommend icing your shoulder. If it's really giving you a lot of trouble, every couple of hours, 15 to 20 minutes, 30 minutes is going to be your hard ceiling. Most gel packs and ice packs don't last longer than 30 minutes anyways, but we start to see a loss of therapeutic effect after about 20 minutes. So, but you want to make sure that you are getting a responsive cooling effect. The area should go numb-ish, okay, after icing. So if you start to get that effect after 8 minutes, 10 minutes, it's okay to take it off, but try to leave it on. If it feels like it's too cold and it feels like you just can't tolerate, it's okay to take a layer of something, whether it be a towel or a small bed sheet or something like that. Put that over the area, give yourself a little bit of extra padding, but always make sure you have at least one layer of fabric of some kind, whether it be a pillowcase or a towel or something, between your skin and the gel pack.
How about, John, if I work at a computer all day long? What would you recommend?
So computers and a lot of ergonomic settings can be notoriously bad on the shoulder. So what happens, I'm going to have Julie sit here and kind of demonstrate for just a second. So most of the time when we sit at a computer desk, we are working with our hands probably about here. And usually if we're working at a computer, our head might even be tilted down a little bit. So this is okay for short periods of time. Laptops and things like that were designed to be mobile, so you can take them to and from places easily. So go ahead and relax for me, Julie. The problem with that is, though, is that when your head goes into a tilted position, and when your shoulders come forward into kind of that typing position, we see that the shoulders are now protracted, the head is forward, and this puts a lot more stress onto the base of the neck at the cervicothoracic junction. There will be a test over this later. And pulling the shoulders forward, which then weakens the muscles behind the shoulder blades. So in order to change this, to make sure that the muscles in the back are not getting too strong, so that the neck is not being stressed, and I did mention earlier, but the muscles in the front of the chest don't get tight, in contradiction to getting too loose and weak, we're going to pull the shoulder blades back. We're going to drop the hands down so that our elbow is at approximately a 90-degree bend. And we're going to make sure that the screen is up high enough so that the eyes are able to look solely ahead, and that way we're not putting too much strain onto the neck. This is very important for our friends and our patients that have prior neck issues, whether you have a bulging disc or if you've had maybe perhaps a surgery in your neck. This is an excellent and very easy and cost-effective way to reduce strain on your neck. Okay, so Julie has done a great job with that. If you are working from a laptop and you're thinking, how do I change this? It's very cost effective to go out and buy a cheap keyboard that has a USB port attachment, put that into your laptop, and set your laptop up higher onto a stack of books, onto a small box, something like that, so that you can have the screen up a little bit higher, have a desktop keyboard right down here for you, but then you're not sacrificing the ergonomics of your shoulders and your neck. Your body is far more important than your computer. Let's try to make other things work around the body. Anything you want to add to that?
Other than with everyone working from home since the start of COVID, we did see an influx of shoulder pain patients due to the poor ergonomic setups that they have at home. Most companies sent people home with laptops versus desktops, and that's where you run into problems with neck and shoulder pain because of the laptops. So just be aware of that.
So nice and easy, just get the screen up a little bit higher. If you are on Zoom calls and things like that, no one's going to notice. In fact, you might get some compliments on your good posture. Okay. So we talked a little bit about rotator cuff pathology. We talked about reasons why you may need to have surgery. What are some things from an exercise standpoint that we may get into if someone comes in for pre-rehabilitation?
So what we typically do for prehabilitation with a rotator cuff impairment or pathology is we're going to focus a lot on the shoulder blade, or we'll call it the scapula, but for purposes of the video, it's the shoulder blade. So we're going to focus a lot on the middle trap, the lower trap, and the rhomboids to help stabilize the shoulder blade, which improves the position of the shoulder, allowing for decreased strain and stress on the rotator cuff tendons that come through the shoulder. So you may come to therapy and eventually ask the question, like, why am I doing all these mid to low back exercises when it's my shoulder that actually hurts? Well, to start, we have to focus on the posture, because 9 times out of 10 people with rotator cuff injuries are going to come to see us all hunched over because they think that that's the most comfortable position for their shoulder. But in actuality, if we can strengthen these muscles back here, it's going to reduce the strain placed on that rotator cuff pathology. So we'll focus a lot on the shoulder blade muscles. Did you want to review any exercises or?
No, I think that's great.
Okay.
I think with just to Julie's point, talking about how important the shoulder blade is, it really is kind of the cornerstone to a good rehabilitation before and after surgery. If you've never had an injury in your shoulder before, you probably never had to think about your shoulder blades. But once you get into physical therapy and discussing all the things that we have to be able to do to restore normal range of motion and restore strength, actually it really becomes a central point for all of these things.
But John, with these exercises that we do, if I have a rotator cuff tear, with these exercises that you give me in therapy, would they make my tear worse?
It certainly wouldn't. If anything, they're going to decompress the area that's injured, and they're going to relieve strain onto that injury. Imagine it's kind of like if you're trying to seed a new yard, and you're trying to help that yard get the new grass and everything. You have to stay off the grass. If you have kids or dogs or whatever running across the grass, eventually over time, yes, you will get patches of grass that will eventually come up. But nothing like if you had people just completely stay off the grass for a few weeks and let that grass come in. That's essentially a simple way of looking at your rotator cuff. Pulling those shoulder blades back gets everybody off the grass.
Yep, I
So,
would agree.
So, with all that being said, is there any pearls or anything like that you want to kind of send everybody off with?
Other than sleeping positions, posture, and ice, avoid the things that hurt. Those are the typical go-tos. I can't stress enough the sleeping positions and posture. Even if you don't do the exercises that we prescribe, if people can pay attention to their posture and their sleeping positions, they feel better. They're not going to get better, but they feel better for the time being. Then if they are feeling better, they might be more inclined to do the exercises that we give them, and then they can maybe manage their pain and get through it and not have to have surgery.
Another little thing that I would say on top of all that, which I totally agree with, is little things kind of like Biofreeze or other topical analgesics or anything like that. You can certainly put that over your shoulder if that makes it feel better, and that's certainly something that you can give a try. Otherwise, feel free to stop in at our clinic and come and talk to us about anything regarding your shoulder. We're always happy to take new patients and discuss any issues that you may have. If you are looking for an orthopedic surgeon, our office does have board-certified orthopedic surgeons and specialists in their field, not only working with the shoulder, but also working with knees and with feet, and also with some plastic surgery issues, including the forearm, hand, and face. So feel free to stop and look at our website, check us out, and if you have any questions, you can give us a call.
Thank you.
Thanks a lot.